On. All right. Okay.
Thanks for the impromptu filming moment.
Yeah. Do you want me to say anything at the beginning? Do you want me to repeat any of this for the video?
I'm sorry?
Do you want me to repeat any of this for the video? You can do it?
You keep your flow
Okay.
where you are.
Okay. Do you want me to stay in one spot?
No, you can.
It's going to follow me?
Do your thing.
Okay. Okay. So, strangulation and sexual assault, there is a link. Half of all DV cases include sexual assault. At least a quarter of all DV cases include strangulation. If you don't ask, you may not know. It's something we particularly need to ask. At least 25% of all sexual assaults include strangulation also. And it's difficult for victims to talk about sexual assault. We need to ask. And about strangulation. And one of the ways, if you ask someone, has anyone ever strangled you? They may be taken aback or not quite get it. All right, so you need to ask as sane nurses, these are sane nurses, so they understand how to ask questions, general questions, and then hone that in. Has anyone laid hands on you? Women that have been strangled get it. They know what you mean. Has anyone laid hands on you? Okay. Ever had any neck injuries? Did he ever put his hands on your neck? We need to ask that. Also, 34% of abused pregnant women report being choked. Pregnancy increases the chance of domestic violence drastically, as we all know. This is a study of pregnancy-associated mortality. Homicide, the leading cause of death in pregnant women. Not car accidents, not died during childbirth. Homicide. So pregnancy and the year after pregnancy greatly increases that. I am on a pregnancy mortality review board in Ohio, and we're reviewing all these cases. We're up to 2010 now, and there is a lot of violence there. Also, maternal mortality in the U.S. from all causes has decreased over the years. We're doing a lot better with care during pregnancy and delivery. But maternal mortality due to injuries has not decreased any. So we have to pay attention, especially those of us that are dealing with pregnant women. We have to intervene, because we're doing nothing for the amount of homicides of pregnant women or with the year during her pregnancy and the year afterwards. So strangulation accounts for 10% of all violent deaths in the United States. I think that's really underrated. And 68% of battered women were strangled. 68%. These are battered women that's had been battered over years, and they were interviewed. 68%. 53% it was manual strangulation. 8% was with a rope, clothing, seat belt. You don't have to get sophisticated. I have seen women that have been strangled just with their T-shirt. You just pull the T-shirt up behind them, and that's enough to do it.
Power cords are a big thing right now because they're plentiful. They're charging up their equipment at home,
Oh,
their phones.
sure.
So that's
Those little power cords. They're handy. Seat belts, anything. Anything. 5% was forearms, 31% multiple methods. So these are women, almost 500 women that used health services and reported intimate partner violence. Almost half of them did report that they had been strangled at one time or multiple times. Okay? So it's a lot more common than we think, and if you don't ask, you don't know. You have to ask that specifically. So, and with this group of strangulation victims, 34% were strangled 3 to 5 times, and 23% more than 5 episodes. Yeah, so many times when you see how many victims come to the hospital, or come to see an advocate, or go to law enforcement, you're seeing a very small percentage. When they come, we got to take care of them. Use that as an opportunity to really intervene for them. And if they disclose strangulation, it may not be the first time. Females are 6 times more often victims than males. A female can strangle a male twice her size. Isn't that interesting? As a matter of fact, those in our armed services are taught strangulation as a lethal form of close combat. Okay? They're taught how to strangle somebody as a lethal form of close combat. And yet women are strangled every day, and we call it choking, and maybe he'll get an overnight in jail, maybe not. It's not right, is it? We need to put this all together. Male assailants are often intoxicated. So when he says he choked me, understand you are hearing something that's very important. You need to go back and talk about that and pay attention. It's only the tip of the iceberg. If this woman says he choked me, this relationship has been getting bad for a long time, and he's about to kill her. That's what we need to come at these cases with. She will be dead unless we can do something to help her. And she is only a small percentage of women that are being abused. And she's here now. We've got to deal with it. So how does a victim feel when they have suffered a strangulation injury? Overwhelming feeling of helplessness and vulnerability. You know, he doesn't even have to go get his gun. He doesn't have to have a concealed carry. He doesn't even have to have a gun. All he has to do is reach out his hand. 10 to 15 seconds, she's unconscious. And it may be the last time. She doesn't know. And it can happen at any time. It's a haunting experience. Realize that you barely survived. But the evil, ever-threatening danger is always present because he lives in that same house. And on top of that, she has babies in that house, doesn't she? That she's got to protect. It's frightening to know that someone who loves you was willing to kill you and almost did, and maybe will again in the future. And it's a constant feeling of terror, danger, and doom. So this victim is constantly, her brain is constantly triggering, be careful, what's going on, always aware of her surroundings, always has that part of her brain that is fear and flight, you know? What am I going to do? What if happens? And always constantly being diligent. It takes up a lot of energy and a lot of brain space. Okay? She's a survivor. So this is your elevator talk on strangulation. So you're on the first floor. Somebody says, strangulation, what's that? Okay, comes up in a conversation. You're going up to the 3rd floor. What are you going to say? This is it. Seconds to unconsciousness, minutes to death. And victims can die up to 3 days late or later with no external trauma. Now you'll get their attention. What do you mean? What is it? What's going on? That's what you say. I want this to be your mantra. I want you to think about this as you go to sleep at night and wake up in the morning. Okay? Seconds to unconsciousness, minutes to death. And victims can die up to 36 hours or later, as you will see, with no external injuries. It's all of the internal injuries and internal trauma as a result that will kill her. So, choking is more accurately defined as strangulation, as Lillian said. It is a common mechanism in IPV, in interpersonal or intimate partner violence, and it's often underassessed and underappreciated by healthcare. And we need to get the word out. We need to share this information and make it a priority. So here it is. This is the difference between choking and strangulation. Make it very clear. So choking, definition, is obstruction of the air passages of the neck, the actual breathing tube, from a foreign body is like a piece of food, a piece of candy. gets stuck in the throat. That's choking. And what do we do for choking victims? The Heimlich maneuver, okay? That is choking. Obstruction of the airway from something inside the airway. Strangulation, on the other hand, this is the most commonly agreed upon definition. A form of asphyxia, asphyxia meaning no oxygen. A form of asphyxia characterized by closure of the blood vessels and air passages of the neck as a result of external pressure on the neck. So it's external pressure. That is strangulation. Okay? So that's the first point we want to make very clear. So there's your foreign body, and then you use a Heimlich maneuver to get that foreign body out. That is choking, and that's not what we're talking about. So victim reports choking. You quote them, right, in your documentation. Patient says, I was choked. Okay. But you call it strangulation, okay? Just like somebody comes in and says, oh, I have heartburn. Oh, he's got chest pain, right? We don't say, doc, he doesn't have any. It's not his heart. He says it's heartburn. It's not chest pain. No, you know it is chest pain until proven otherwise, right? Okay, so if someone says I'm choked, you document strangulation because that's what it is. Let's call it what it is, as serious as it is. So there's 3 different forms of strangulation. There's manual with the hands, ligature, and then there's also hanging, and there's 2 different kinds of hanging. There's suicide, and then there's autoerotic asphyxia. Do you guys all know what autoerotic asphyxia is? No. Okay. Autoerotic asphyxia, and if you're dealing with victims, you need to be aware of this. This has been going on quite some time, and it's the thought of, you know how kids do the choking game? That's another form of strangulation. Well, autoerotic asphyxia is where during sexual acts, the neck blood vessels of the neck are closed off, and just before going unconscious, the goal is to reach orgasm then. And it's supposed to accelerate the sensation in the orgasm because of the rush to the head. It's not only in homosexual communities and relationships, it's also heterosexual. And during sex play, sometimes that is used. All right? But I have had victims that have said, you know, he put a belt around my neck, and he said, do you trust me? Do you trust me? Do you trust me? And then all of a sudden I thought, he's going to kill me. And he said that was it. And he reported being strangled. Okay? So that is another form of strangulation. And sometimes if it's autoerotica, meaning one person, okay, that is somebody that does this as they're masturbating, and as they, just before they lose consciousness, they've got a way to release the pressure. Okay, they step down off the stool, they step up on a stool or whatever. There's some mechanism where just before you lose consciousness, you take the pressure away, okay, so you don't die. But sometimes that doesn't work. All right, so those are all the different types of asphyxiation injuries. So there is manual. These are the actual best appreciated terms for all of this. So manual is a form of strangulation caused by external pressure on the structures of the neck by hands, forearms, your knee, other limbs. Ligature is a form of strangulation in which a pressure on the neck is applied by a constricting band that's tightened by force other than the body weight. So your telephone cord or your charger cord. T-shirt. Doesn't have to be sophisticated, okay? And then hanging is a form of strangulation by which a pressure on the neck is applied by a constricting band tightened by gravitational weight, okay, of the body, or part of the body, so that as you go unconscious, the weight pulls the head down and relaxes the muscles, and you die from asphyxia. Okay. So that is from the Journal of Forensic Sciences. That's the most appreciated definitions. So when we're talking about what the internal injuries are, we're going to talk about blood vessels, muscles, cartilage, and bones. Okay? Those are the structures we're going to discuss. There are others, too, that have come out in recent studies that we'll briefly discuss. But the handout that the handouts, they didn't get the handout. So will you be able to get them, the handouts, Lillian, that I sent to your secretary? Yeah, it includes a big bibliography. That's a growing bibliography I've got. It's 5 pages long. We started off with about 4 articles in year 2000, and now we've got a lot of research. So in the bibliography includes a lot more in-depth information in all these areas, okay? So this is the picture that I use when I testify in court, because it's very simple, very easy to understand, and to explain the injury. So I'm going to start with my next little bit here is how I explain this to a jury, to a lay jury, okay? And it's very easy. They get it. They get it very easily. As a matter of fact, Gail Streck found that juries going into a strangulation case, in interviewing them after the case, they said, you know, didn't understand what was the big deal about choking injuries. What was the big deal? Once an expert witness explained this to them, they wondered, why in the world was this only a misdemeanor? This should be a felony. So they get it. And nurses make great expert witnesses, because you talk to lay people every day, all day long, explaining what is going on with their loved one, right? And to patients in layman's terms so that they understand their health care. So nurses make great expert witnesses, especially forensic nurses. All right, so these are some of the inner structures of the neck. And right in the middle is your breathing tube. On either side of the breathing tube are your blood vessels. The red line here is your carotid arteries right along your neck. And they're pretty superficial. They're close to the surface. It's where you take your pulse when you're taught to do CPR and check a pulse. That pulse is your carotid artery, right alongside your neck. On the other side, just alongside that carotid artery, is your jugular vein. That's the large vein that drains the blood from your head. So your oxygen pumps freshly your heart pumps freshly oxygenated blood up to your head to supply your head and your brain with freshly oxygenated blood. Then the blood comes back down after it's lost its oxygen, comes back down in your jugular veins, back to your heart, to your lungs, to again get more oxygen to give to the brain. So what happens when you have pressure on the carotid arteries from a hand, a ligature, or whatever, you close this off. It takes very little pressure to close off the carotid arteries. When that happens, you have stopped or greatly decreased the blood flow to the head. Now, when I'm going to sew someone's arm up, I can put a tourniquet on their arm to stop the blood flow so that I can clear the field, clean out a wound, and sew it up. I can leave that tourniquet on for about up to 30 minutes. No problem. As soon as I release that tourniquet, blood comes back, and there is no consequence to circulation, sensation, function of my hand and wrist, okay? Because my muscles can store energy, and they can store oxygen, and they can survive even when the blood's cut off for up to half an hour. Not forever, but up to half an hour, no problem. because my muscles store energy. Our brain does not store energy, okay? The cells of our brain are 100% dependent on a constant flow of freshly oxygenated blood bathing those cells in the brain. If that freshly oxygenated blood is cut off, even for seconds, brain function decreases. And it can decrease anywhere from being confused, vision changes, to memory loss, to psychosis, to anywhere down there, dizziness, vision changes, loss of consciousness, and just before loss of consciousness, unable to control bowel or bladder function, okay? And lack of oxygen to the brain can cause anywhere along that big continuum, from feeling lightheaded and confused to death. Some cells die immediately. Some brain cells take hours or days to die, okay? Now, if that blood is resumed in just a few seconds, there's minimal damage. If right along the carotid artery, if the blue line, which is your jugular vein draining that blood from your head, if that is closed off also, or if that is only closed off, what happens is you get a damming effect. All that blood is not able to come back to the heart. So you get like a damming effect where that backs up, that pressure backs up into your head. It can't come out of your head, right? So the blood in the large veins, all the way up to the capillaries, it's a backflow of pressure. Just like a dam backflows water. This pressure backflows and increases the pressure in your head and in your brain. Now we all know, those of you in nursing school, you remember there is a very fine mechanism of pressure inside the head, okay? Because our brain is enclosed in a skull, if pressure increases in our head, there's nowhere for that to expand, and it only compresses other areas of the brain, right? And there's a very fine line, a very fine mechanism that controls and keeps that pressure in your brain exactly where it needs to be to maintain brain function. Any change in that pressure decreases the ability of your brain cells to function and decreases oxygen to those brain cells. And oxygen is vital to function, okay? So you have a damming effect, and you have a backflow of pressure in these blood vessels, and it backs up into these teeny tiny little capillaries, okay, that are 1 cell thick. And those tiny little fragile capillaries, what happens to them? Just like blowing up a balloon, you blow it up and blow it up, more and more air. Past capacity, what happens? It pops. So these tiny little capillaries pop, and they bleed out. It's a hemorrhage, okay? They bleed, they pop, rupture, and bleed. That is petechiae. Those little tiny red spots from strangulation injuries are from petechiae. And petechiae can be found anywhere above the level of stricture. So, again, decreasing function of the brain. Now, if pressure is placed in the front where your airway is, different things can happen. Now, your airway here is cartilage. It's made of cartilage. Cartilage is stronger than muscle, but not as strong as bone. And it's able to move and has remembrance of its shape, such as your earlobe is cartilage. Okay, it's flexible, but when you fold it over, it springs right back, right? That's the benefit of cartilage. A little bit of movement, and it remembers its shape. But it's not as strong as bone. That is what is it's made up, your breathing tube is made up of cartilage. So this right here Right inside here is your voice box, okay? This is your Adam's apple. And this is made of cartilage. And then below here are the tracheal rings, okay, down here. They are sturdier cartilage, and they're rings. And in between are these ligaments. There's ligaments up here that connect to the hyoid bone. And these rings are real sturdy so that we could move our head. It's kind of like a slinky, you know? You can move your head around, but your airway doesn't close off when you do this, right? It doesn't kink because of the cartilage. And you can give, it can give some. So if you have enough pressure on the front of your neck to close off this airway, it can be done. And if it is closed off, it might break. Or you might have like this, a little crack, little micro cracks in that, but it very likely will spring right back. All right? Especially if a woman is under the age of, say, 40, up until you're 40, 45, your cartilage is more flexible, more forgiving. All right? After 50, 60, it's more brittle and it's more apt to crack and break. But it's more flexible and forgiving when you're younger. So a younger woman could have her airway totally closed off, totally blocked off. And when it bounces back, come on in, have a seat, get some coffee. But it can spring right back. However, what might happen is these little cracks here is an injury. What happens when you have injury? Anytime you have injury, you bruise your arm. You expect over the next 12 to 24 hours you're going to have swelling, right? And that swelling lasts for 3 or 4 days. Now, during the time of that swelling, what happens if you have swelling of the tissue in your airway, inside your airway? What do you think might happen? As that swelling sets in over the next 24 hours, lasts for 3 or 4 days. When your airway is only about 1 inch in diameter inside, and it's surrounded by tissue, then your cartilage, and your cartilage is surrounded by tissue and muscle layers and all of the soft tissue of your neck, right? What happens when that tissue swells? That's right, over the next 24 hours. So you expect that over the next 24 hours you're going to have swelling. And if there's trauma, the inside of that airway tissue is swelling and closing off the diameter of your airway. Again, now you've already had potential decreased oxygenation to the brain, right? And now you're closing off that airway. Not good, is it? And that happens, that swelling is a normal part of the healing process. When you're in an auto accident and you get out of the car and you go, phew, I'm okay, and you feel fine, right? The next morning, you can't get out of bed. Why is that? It's that swelling of the tissue overnight, pushing on nerves, making pain. Yes, Ellen?
I've heard that if a victim describes hearing crackling noise, that is something that we should then tell the victim, you need to get to a doctor or hospital right away. And you talked about the popping of the cells, and now you're talking about the cartilage maybe having fractures or cracks in it.
Right.
Is the popping related to any parts of those things that you've just talked to us about?
Yes, that can very possibly. It's called subcutaneous emphysema. Is that what you mean? The crackling of the skin?
I've just heard that it's, if the victim describes hearing, and I've had them tell me, I heard this crackling or like popping in the packaging that
Okay.
you put in packages to mail.
Okay.
When you burst the little plastic bubbles, that if a victim says to me during a meeting within a couple of days after they've been strangled, I remember hearing something that sounded like crackling or popping noises, that is an escalated medical concern.
That's really interesting. I've not heard a victim tell me that, but that's another thing that we need to pursue. I'm thinking it could be a couple different things. It can be this tracheal rings or cracking of this cartilage, right? Doesn't that make sense? Cracking of this cartilage. But it also, when this is cracked and you have a little micro crack here, or there's a fracture of the cartilage, what do you think escapes into the skin? Air. Air escapes into this tissue, okay? even if this seals back up, air escaped. And when air escapes into your tissue, it feels like Rice Krispies, okay? And it's a Rice Krispie because you have these little air bubbles in your skin that it resolves over 3 or 4 days. But if you have any crack in that cartilage, air can escape, especially the victim is gasping for air, right? And air can escape into the skin. And over the next couple of days, why it's very important to feel the tissue around the neck. Feel for Rice Krispie crackles. I wonder if that's part of it.
It could have been, and I remember hearing it several years ago. It doesn't come up in every interview I have, but it does come up on occasion, and I always remember someone describing the noise and saying, make sure that that person is told, you can't wait, you need to go see a doctor right away.
Yes, good. That's interesting. I'm going to keep my ear open for that. As I've been doing these trainings nationally and talking to people that have cared for victims, I'm hearing a lot of different things, and victims are telling me some symptoms that are like, wow, that's interesting. And I'm feeding this information to those that are doing the research right now, including Dean Hawley. He's our forensic pathologist at Indiana University, and he was on board from day one with this back in 2000 with Gail Streck. And he is doing his own research now, but he is our strangulation guru with forensic pathology and speaking to physicians and nurses. So I feed that into him. He's doing a longitudinal study of victims, what happens with their health later on in life as time goes on as a result of strangulation injuries. So that's another one I'm going to ask him about. Keep this one in mind, because if you don't understand all the different injuries that can happen, you don't know what to ask, right? But if you know the injuries and you're hearing more injuries, you know what kind of questions to ask to see if they are disclosing any of those injuries. Because what they disclose to you makes you concerned more and more about their health and what kind of health sequelae they're going to have as a result of this. Okay. All right. I'm sorry.
Captured in an X-ray or any form of test?
Well, when we started this, we just come out with CT, and CT is what we were advising people to get. But that would show some soft tissue injury, but not enough. And the concern is if you do a CAT scan of somebody's neck, a CT of their neck, at the onset of this injury, well, that's not as much a concern as what's it going to be like tomorrow. All right? That's why these victims die over time, because of the swelling setting in and this brain cells dying and all of this stuff.
So we'd see it in the autopsy if we had a pathologist involved?
Yes.
Okay.
And Dean Hawley will say, he said to me at our faculty meeting with the Strangulation Institute, he said, Ruth, I don't know, I can't tell you why some victims die and some do not. I can't tell you. Because over and over again, he does autopsies on victims that you'd never even suspected strangulation, and yet that's the cause of death. They had no external injuries, but that's the cause of death. So victims die with no external injuries. Yeah. So we have to be extra vigilant when a victim does come to us and does disclose this. We better act, okay? Because that's a small percentage of these victims that we're seeing. All right. Did I answer that? Okay. So I'm just going to show you a few pictures of the anatomy. Sometimes pictures stick better than words, okay? And of course, get your anatomy and physiology book out, and our SANE nurses can lend them to you if you want to look at them. And study the structures of the neck, and it'll make more sense to you. So here is the main carotid artery coming up your neck, okay? Here's your voice box. All right, it goes right along your neck, pretty external. Then it breaks into these branches that go into the brain, into the face, okay? But this is the major artery right alongside your neck. See how easily that it goes just like this. All right, that's your carotid artery. So here's your carotid artery coming up. This is a vein, your major jugular vein. It's cut off here. Okay, but it comes all the way down here, follows this right down. See how close that is? And you see, here's your voice box. It's not far. It's still the front of the neck, isn't it? Now, you can also see all these muscles, all kinds of muscles of the neck that allow us all of this movement of our neck. It's amazing movement of our neck, okay? And it's because of the muscles that go in many different directions. Here's, look at this muscle here, okay? And then you've got your back muscles here, your strap muscles. This is your muscles connected to your clavicle, your sternocleidomastoid. There are all these names of all these muscles, but you can see them. And here is your muscles that allow you to do this with your chin. Okay, big muscles. What happens when you injure your muscles? You get swelling, right? A lot of swelling. And what's happening, look at these yellow lines here. These are cut off here, but they go down here. These are nerves to your face, to your head, your skin. These are major nerves. And they're buried deep in those muscles. Some of them are more superficial, closer to the skin rather. All right? So what happens when those muscles swell and or from the injury itself, pinching off nerves? What happens when you hit your arm really hard, your funny bone? Sometimes that can zing for a day or two, can't it? Okay, what about these nerves in your face? You can have facial droops. You can have on inability to talk because of the nerve to the voice box, okay? Many different neurological sensations as a result of trauma to these nerves that are deep, some superficial, close to the skin, some deep in those muscles.
Can I just interject there? That one of the things that comes up in our reports on non-medical folks, and may show up if they see a medical person, is that the victim has trouble swallowing, and like you just mentioned, speaking, obviously.
Yes.
But that sometimes can be very helpful, particularly at bond hearings in the initial stages of the criminal process, to convince a judge or a magistrate that something very serious has happened when there are no marks that the officer could see, but they can say, I tried talking to this victim and they had a hard time swallowing, couldn't sip the water that was offered to them, and had a very sore throat, is how they describe it.
Very sore throat. And that can be from a cracked cartilage. It can be from the swelling of the throat, the swelling of the tissues of your throat, just like you're having strep throat, a beet red throat, it's trying to heal, all right? The other thing is, you saw on that other picture, your hyoid bone. Did you remember that little bone that goes up here at the top of that voice box? It's a floating bone right up here, okay? It's a horseshoe-shaped bone right here, and it supports the floor of your mouth. It's attached to your voice box and your voice box and your cartilage by ligaments. And these ligaments, it's a suspended bone, okay? And these ligaments can be damaged, traumatized, okay? When that happens, the hyoid bone may be okay, but the ligament's damaged, and that ligament is used when you swallow. Anything on the floor of your mouth could be very painful. Also, there's a lot of anecdotal information that we've not done any research on yet that is very interesting. As a matter of fact, victim contacted me not long ago of a strangulation and rape that she suffered when she was 14, and she's now in her 40s. And she heard what I was doing, and she came forward. She said, I got to share my story. It's time to share my story. Nobody around here knew her story. But she was strangled at 14 and raped, almost died. And the prosecutor dropped, this was years ago, the prosecutor dropped the strangulation, the DV, the choking part, and only prosecuted on the rape without saying anything to her, okay? And to this day, she says, I survived a rape. I knew from that rape, it was awful. Absolutely, believe me, it was awful. But I knew I'd survive that. I knew I might not survive that strangulation injury. That was what caused so much of the post-traumatic stress disorder she had. and the pain and the scariness, all of that stuff. She said, the strangulation almost killed me. I knew I'd survived the rape. And she was, you know, and to this day, she said, that was the most important part of it, was the strangulation. And people will tell you that, yeah, rape is bad. I mean, nothing to say rape is not bad, okay? It is bad. Strangulation, though, for a victim, if they've been strangled, they know they could have died, and they were very close to death. So what happened to her was that ligament that supports the hyoid bone is the only way I can figure. She said ever since that day, she can't drink a can of pop. She goes to put her head back to drink a can of pop, and her airway closes off. It closes off. She could never figure it out. She just has lived with this. She can't put her head up like that, this movement. But when that happens, though, and she can't swallow then. She can't swallow, difficulty breathing, and she learned to manipulate her neck back and click it back, whatever that is, click it back. So the only way I can figure is it's that hyoid bone and the ligaments that were overstretched, and they never did repair. And when she goes like this, it clicks over, closes her airway off, and she's got to click it back. She almost died during surgery as a result. They took the tube out, her airway tube out, and she couldn't get it open. She almost died. So we're looking at lifelong injuries that we're just discovering on top of what I've just shared with you. Okay. All right, so here is all of these muscles of the neck. See all these muscles of the neck, and then here are your blood vessels. Here's your jugular vein coming down. See how they're deeply buried in these muscles. Here's your voice box. So no wonder their necks are sore, right? Okay. No wonder they can't move their neck, depending on how much, and these are all, again, all your muscles. And the yellow are your nerves that go through those muscles and can be affected too. So you can see the proximity of all of that. And here is your voice box. Here's your hyoid bone up here. Okay, very close. All those. So here, isn't that a beautiful picture of the larynx? I just love this picture. I wish I had it in real life. So here is your hyoid bone, and your hyoid bone is like a horseshoe. And up until you're about, like I said, 45 or so, it's mostly cartilage. You know how children, their bones are cartilage, you can bend, and as they get older, the cartilage is slowly replaced by osseous cells or bone, and so it gets firmer. So the same with your hyoid bone. And the horns, especially, can be more cartilage than bone, which means they're more flexible. Okay, they're not. If this happens to your hyoid bone, it won't break when you're younger, unless it's, you know, of course it can break, but it may just spring back and be cracked or whatever. But the ligaments can be damaged, right? The soft tissue can be damaged. So rarely is the hyoid bone broken. And when I started this, you know, the docs would say, well, they must have broken their hyoid bone. That was just taught in medical school since day one, is that, you know, if strangulation injuries, they have a fractured hyoid bone. Well, now we know no. Rarely is a hyoid bone fractured in a victim that survives strangulation. On autopsy, if the hyoid bone is found fractured, it is strangulation until proven otherwise. Once that hyoid bone is fractured, you lose the floor, the support of the floor of your throat, and your airway just closes off. Okay? So imagine if these ligaments here that support it, and then they support it up into the floor of the mouth, there's your tongue, epiglottis. Tongue comes out here, there's your epiglottis, that thing that shows up in the back of your throat. Okay? Any of this soft tissue can be damaged. And then you have your voice box here. Right behind it is your voice box. Here is your Adam's apple. And then you have all these muscles and ligaments here, so any of those can be damaged too. All right? Got a good picture of that? Make sense? Okay. Now here's another layer of tissue on top of the voice box, Adam's apple, this cartilage airway. On top of this, you know what this is? Anybody know what that is? It's your thyroid gland. Okay? It's soft tissue. It sits right on top here. It's real superficial. You can feel your thyroid gland here. All right? What happens, and there has been case studies of the thyroid storm. Nurses know what thyroid storm is. It's your thyroid controls your body's metabolism, and if your thyroid gets hyperactive, I mean, you're on speed, right? Your body's on speed. Your heart rate's like really, really fast, and all of this stuff. And it can be life-threatening, all right? You've just sped your whole body metabolism up. And there is a case study of thyroid storm as a result of strangulation, okay, from damage to this gland. You also have along here lymph nodes. They can bleed out. Okay. So here's a chokehold. Everybody kind of knows what the chokehold is, right? Chokehold is something that law enforcement used to use routinely, not as much anymore, because there was years and years ago, I don't know if you guys remember, many years ago, California, I think it was actually San Diego, there were guys that were dying in jail. Young healthy guys were dying in jail, and they couldn't figure out why. They finally decided the common denominator was they were all, law enforcement had used a chokehold on them before they put them in jail. And they were dying days later. Chokehold was the only common denominator, and so they decided that we're limiting the amount of the amount of compression that law enforcement can use in a chokehold. Some law enforcement agencies are told not to use it. Some can use it under certain circumstances. You get special training for the chokehold. And if they have special training to use a chokehold, many law enforcement agencies are told if you use a chokehold, that person needs to be observed for 24 hours for their safety. And yet men strangle women every day. And the most they get sometimes in many jurisdictions may be an overnight in jail, a slap on the wrist. Okay? Why do we treat our prisoners better than that? Interesting thing to think about and contemplate. So if this is considered serious enough that you can't do it, we shouldn't be doing it to our women and children. So this is not to be used in court, okay? This is not a valid study. Do not use it in court, but it's a good thing to keep in mind when asked, well, how much pressure does it take? And I was asked that in court one time. People want to know how many pounds per square inch. You know, it's like, whatever. Not much. So here is the carotid artery occlusion. Front of the neck, 11 pounds of pressure is all it takes. That's not very much. That's doing this. 11 pounds of pressure for 10 seconds, you can be unconscious. That's all it takes. All right? To the jugular vein, less. 4.4 pounds of pressure, 10 seconds, unconsciousness. To the cartilage of your airway, about 33 pounds of pressure, 10 seconds, you're unconscious. Okay? That's all it takes. So a guy doesn't even have to, the abuser doesn't even have to go get his gun. He doesn't have to get to the kitchen, grab a knife to threaten her. All he has to do is go like this. And he controls her next breath. We all know that domestic violence is all about power and control. Isn't that the ultimate control? I determine your next breath. Okay. But this cannot be used in a court of law to back up any of this is not valid research. How do you think they came up with this? Next time you see a medical student, give them a hug. It's medical students. How long before you go unconscious? So it was not repeated, as you can imagine. It's not validated research, and no one would ever repeat it, I don't think. But that's how they got this. So you see all the injuries that can happen, all right? Now we're talking signs and symptoms. What is this victim going to tell you? And by the way, when I say victim, patient, survivor, all of our professions refer to these women and children in different ways for very important reasons, okay? So law enforcement's victim are SANE nurses and myself, are my patient, and as advocacy, are you ladies in advocacies? Okay, so your survivors, they're all one and the same, right? Okay, so I use different terms, different words. Please understand that it's because I'm inclusive of all of you guys, and there's certain times when we need to use the term victim, and other times survivors, etc. Okay, so now here we are with the signs and symptoms. Understanding what can happen inside. Why do you think there's voice changes? Is it understandable that half of them have voice changes? What's that from? Well, you have the laryngeal nerve going up there that allows your voice box to work, right? You also have muscles in the neck, and you have swelling of your airway, which is what you use to talk. Air has to come in for your voice box to work. All right, so hoarseness or loss of voice can happen, understandably, right? That's from either swelling of your voice box, so you can't talk because it's soft tissue injury, and you can't talk, or that nerve is damaged and your voice box just doesn't work, so you can't talk. So this is your vocal cords. Let me give you a good visual of vocal cords down in here, okay? If you were to take a flexible scope, like they use in the hospital, and put that flexible scope in the back of my mouth and look down, and now you're looking at the end of this, down my throat, this way. This is what you see. Okay, here's your tongue. Here's your epiglottis. This is your airway, all right? And this is your voice box. There are these little flaps that go like this and give us our voice, all right? And right in these flaps, this is your airway coming through here, okay? And you breathe in and out, and as you're talking, it's doing this at the same time, all right? So here's your airway, your breathing tube. Right behind your airway is your swallowing tube. No wonder you have problems swallowing, right? Right behind here. All right, so this is a healthy vocal cords. See those flaps? This is your airway right here. Here's your vocal cords, and this is where the oxygen goes down into your lungs, all right, when you breathe. Now, if those vocal cords inside your airway are inflamed, why do they get inflamed? Because of the trauma of the strangulation, right? And we know that swelling occurs over the first 24 hours and stays 3 or 4 days. So this is swollen vocal cords. This is traumatized vocal cords. See how red they are and swollen? Here is the airway. No wonder they have difficulty breathing, right? No wonder they can be confused and their brain has less oxygen. They've already suffered brain damage from the initial injury, and now they're still having lack of oxygen to that brain. No wonder they don't come out of their confusion for weeks or months, right? Yes?
Okay, Mark is a detective that works with me. We're sitting here thinking, how do we get this? If a person goes to the emergency department and says, I was just strangled, is it realistic that they would be able to have something like that done? How painful is it to them? How expensive is it for them? Is there a time constraint on doing that in an emergency room visit, or does it have to go through a different doctor to get that accomplished?
Well, right now, strangulation awareness is not as diffuse as it should be in emergency rooms. Okay? That's what I'm pushing for. Healthcare needs to be on board with this, don't you think? Okay. And not just say, you know, he was choking, whatever, you know. Can you swallow? Can you breathe? You're fine. We need to see how, we need to understand the internal injuries and why these people need to be observed for 24 hours in the hospital, okay? And if they're discharged home, you know how in healthcare with head injuries, we give them very specific instructions over the next 24 hours, knowing that the injuries could occur over the next 24 hours with swelling of the brain. Someone needs to be with you, wake you up once or twice tonight. If you throw up more than so many times, you go to the ER for a CAT scan. Difficulty with memory or stammering or any change in level of consciousness, you come right back and we do a CAT scan, right? All given these instructions. We need to accelerate and give those same instructions, only more specific for strangulation injuries and over 3 days. Yes.
So this takes would this happen from the picture you just showed to this picture within 24 hours?
Not the same person, but yes, that's a swelling.
Right, could that happen?
Sure, sure.
The other question is that without external injuries, that could occur. Is that so, or?
I don't know that this trauma here, with this severe trauma here, there probably were some external injuries. Chances are good, but
Okay.
not necessarily.
Okay. I'm just wondering, like you asked.
Not
how do you
necessarily.
get that if external injuries are there, then maybe that was trauma.
Not necessarily, because, you know, I remember a young woman who was in her mid-20s. She had 2 little babies, mid-20s, a mom, and her husband. She came in with some injuries that were suspicious, and I asked her, I took the time to ask her about it, and yes, these are actually strangulation injuries. And when I asked her about the relationship and the trauma that she goes through with this relationship, she shared with me that he does this about once a week. When he gets really upset, and he'll choke me, and I said, what happens then? Well, I wake up on the floor looking up at him. I wake up and he's laughing at me, and I've peed my pants, and he's laughing. About once a week. He knows how to do it without leaving a mark. And he tells me, I've never told anybody, because he told, no one will ever believe you. There's no mark on your neck. I've never told anybody. And she has babies at home that have been observing this.
But Ruth, again, if a lady or man goes to the emergency department today and says, I was strangled,
Yeah.
how
Yeah.
realistic is it that there would be
Good question.
availability of finding this kind of evidence, and how painful and expensive is it for the patient?
Right. So when we started off with the CT, that was okay, but again, you have to repeat that in 24 hours to see the soft tissue injury. And CAT scans are not good for soft tissue injury as well. Now, MRIs are much more available. Cost is coming down. They're more appropriate for this, because MRIs show the soft tissue injuries. That is the best test to do for these, is an MRI. However, the victim has to be able to lay still for a certain amount of time. She can't be acutely ill because it takes some time. And when we're concerned about the blood problems with the blood vessels themselves, you need to do an MRI and an MRA, which also looks at the blood vessels. They're expensive still, but if you have your ER physicians that have had this training and get it, they'll do it.
And this,
They'll do this test to show.
my impression as a layperson from how you describe this view is that it entails like a little tube
A scope.
camera.
And that can be done even in the ER. They have, many ERs now, more and more, actually have a scope that you can put down, and they use that when they actually intubate people in the ER. Many ERs have one right in the ER that they could use, a scope.
How painful, like, if it's
They
me
numb the
and they're
throat.
and they're telling me I'm getting ready to do this to help document the case so Mark can take it back to the office, how readily am I going to sign up for it? Are they going to tell me that it's painful? Am I sedated
Yeah.
anyway? Am I going to be gagging on this tube and miserable?
That all depends.
Okay.
That all depends. They can spray your throat to numb it and then put the tube back there. They may do some conscious sedation. Depends. And so there's a risk to that. There's a risk to conscious sedation to do that. And so they would do it only if they absolutely had to.
Okay.
Because again, you don't want to cause more trauma going down there. So there's a lot of benefit versus risk that they would have to weigh. And that's not routinely done, no.
Okay.
It's,
We're loving this.
yes, you want that picture.
But not wanting to ask victims to
Yes.
go through a process that is just not appropriate to ask.
Exactly. Exactly. So what you have to fall back on that doesn't hurt the victim, documentation.
Okay.
Documentation and understanding and sharing this information with those around you the seriousness of this and why. So swallowing changes, larynx injury, difficulty swallowing, and the swelling of the tongue from that venous engorgement. Your tongue's a soft organ, isn't it? Very soft. And so you get that backflow of blood, it can engorge your tongue. That swells your tongue, which goes way back here. What does that do to the size of your airway?
Close.
You bet. There you go. Do you see all the different things that can happen? Maybe only one thing happens. Maybe 2 or 3 or 5. Nothing good, right? None of this is healthy. Okay. And you can have any of these things happen. Now there's more. So breathing changes. You can have difficulty breathing. Victims can sound like they are having an asthmatic attack. We all know what that sounds like. But maybe they don't have a history of asthma. Maybe their airway has been closed off enough, or their brain has been without oxygen long enough that their body is trying to breathe in enough oxygen to give to their brain, right? Or they're panicky. Why would they be panicky? We get it, don't we? Why would you be panicky? So it may not just be hysterical reaction, although hysterical reaction could be very normal and understandable with something like this. You almost died, okay? And now you're finally able to breathe, and so you're breathing, you're hyperventilating because you're trying to get oxygen back to your body. And it's also a very scary situation. However, understand that asthmatic reactions, you might just assume they've got asthma. Well, maybe they don't. Maybe this is a direct result of an airway that was obstructed. So remember, symptoms may appear mild. However, the soft tissue injury can cause swelling and obstruction of the airway and death within 36 hours. Raspy breathing or stridor may be premortal. One of our big cases in Delaware, Ohio, and after this I think we need a little break. One of our big cases in Delaware years ago was a woman who was in this relationship with this guy who she invited after only a few months in this relationship to move in with her, and that was when he very much took control and became very controlling of her every movement, and this verbal violence started to become physical. Before she knew it, they had been out drinking one night, and she was talking to a man, and he thought for sure she was making a move on him, and he was really ticked off. So he comes home that night, and he's beating on her and beating on her. For an hour solid, he was beating and choking her in and out of unconsciousness. He raped her. She finally got up to go to the bathroom to try to get away from him, and he took her head and banged it against the sink, and she was in and out of consciousness with repeated strangulation, incontinent of urine, incontinent of stool. Her 14-year-old daughter, his 14-year-old daughter was present, and she tried to pull him off of her, and she had bruises on her arm as a result. So at 3 o'clock in the morning, she goes outside, down the hall, down the apartments next door, banging on doors, trying to get someone to call the cops. Finally get the cops come and take him off of her at gunpoint, still beating on her. Take her to the ER. She goes to the ER. The cop, who is one of I call him our tiger. I mean, you know how you have these great cops that are victim advocates and will not let it go. They're going to get what this victim needs no matter what. This was Tim. And he said, "Do you have a SANE nurse?" She was raped too. The doctor says, "Oh, I don't need a SANE nurse. I'm perfectly able to collect evidence, and besides, she doesn't need it because it was only digital penetration," and you know, foo-fooed him off. They did a CAT scan that night. Well, of course, didn't show much because it was the original injury. Next day, she shows up in court to get for his arraignment and to get a protection order. She's wearing this big turtleneck, and she passes out in court and comes to another ER. Well, this first ER didn't even get pictures, didn't do awful documentation. They didn't document these injuries, okay? And they didn't address all these injuries. So she comes to another ER the next day. She's wearing this big turtleneck, says, yeah, she was raped and beaten up yesterday. Well, the nurses assumed that all of that was done by the first hospital, right? They did all of the exam. They have SANE nurses there, and assumed. However, one of the nurses said, you know, Ruth's always telling us we got to document injuries the day after or the next day if they come in, so maybe we should get some more pictures. What do you think? And another nurse said, oh yeah, we probably should. But they got busy. Didn't do it. No more documentation. The next day, this Tim, our detective, calls me and says, Ruth, you got to help me out. I want this guy on 4 F1s, 4 felonies. I got nothing, and he's mad. You got to help me out. I said, well, the only reason this woman survived, her mother's a nurse. She had stridorous respirations that night. And the mother knew enough that she needed to sleep with her in bed and keep her on her side in that rescue position we all know. Because if she was on her back, she couldn't breathe. And she had this awful breathing sounds. She had stridorous respirations. The only reason she survived is her mother slept with her and kept her on her side, so her airway was open enough to exchange oxygen for 2 nights. So I said, Tim, sounds like she needs to be evaluated again. I start work at 3 o'clock. So we brought her in. She was purple from here up. She had this huge bite mark on her face, florid petechiae. The woman was a mess. She could only talk like this, and it was very painful, and she couldn't move her head. He had stuck glass ornaments from the Christmas tree in her mouth and told her to chew them. She was torn up inside her mouth. And there were 3 ER visits before anyone did any documentation, photographs, and a history of what happened to her. That should never happen in this United States, all right? Never. Don't ever let that happen. Don't ever let a victim come to us and us not respond appropriately. So what we started off with no evidence, we wound up with overwhelming evidence. And he's put away for 12, 14 years. And she's now safe. Pretty scary, isn't it? 3 ER visits? Are you kidding me? Okay, so don't ever let this happen. So this is, I'm going to cross your fingers. And I hope this is loud enough, so be real quiet here. 911 call. Yes, call 911 and get an ambulance there. She can't breathe. She said it how many times? So who's missing at the table here? Our dispatchers, okay? Every one of us in our different disciplines on the front line, when someone finally gets the nerve, how many times has this happened to this girl? You wonder, right? To get her to the point where she is calling 911, get him here, he choked me, I can't breathe, that's it, right? And what do? It's a DV, he said he pushed her. No, that's not what she said, was it? Okay, I can't breathe. You don't want an ambulance, paramedic for your breathing? You know, yes. That's what you call 911 for, right? An ambulance or the cop, she asked for both. So we need to get our dispatchers there too. Every one of us that are on the front line, when someone finally gets the nerve to disclose, we better do something. Because what's the next step when someone chokes you? Homicide. It's homicide. And we have an opportunity to intervene in a few of these cases, and we need to. Interesting case that happened here in North Carolina. The woman whose husband, she brought her kids down here for vacation from Ohio, from my state. And he comes back from vacation in North Carolina, back up to Ohio without her, brings the kids back on the way up, calls his brother, I just strangled my wife, drops off the kids at his mom's house in Ashland, Ohio, and he's gone. You guys finally found her body. And one of the things that was very interesting, they finally got him too, just about a week ago. One of the interesting things, because I followed this along, all the newspaper articles that came out as they're trying to find this guy, as they're trying to find her body, what happened to her, and trying to find, stories were coming out, and there was a little sentence in one of those stories from a friend who said that there had been incidents of domestic violence in the past. And this one sentence said, 2 years ago, she had called 911 and reported being choked. And she's dead. These children have no mom or dad now. Okay. So anyway, you want to take a break? You guys can just stretch. Yeah. Let's take 10 minutes. All right. I need some more caffeine. And okay, any questions where we're at right now? I'm going to show you a whole bunch of pictures next to kind of elaborate on some areas. Any questions that have come up? And by the way, if I don't mention it again, I have my business cards up here and my email and phone. You guys feel free to call me, email me, you got questions.
And the sign up for the nurses continuing credits
are up here. Yep.
So that if anyone needs to sign that, don't forget to do it please when you're ready to go.
Yeah, and evaluation form, even if you're not nursing, please fill one out. We really tailor our trainings and take your advice seriously, okay? There's also a mailing list sign up if you want to be on our mailing list with Forensic Health Care. Okay. So, questions, email me. Every once in a while I get a panicky SANE nurse going, I got to testify in strangulation and I need some help. So we go through and I'm more than happy to help anybody out. And if I can't, I don't have an answer, I got a lot of multidisciplinary people I can refer you to that can help you. There's a great network of us. We're just starting this strangulation thing, okay? We've done it for 10 years. The word's getting out, but there's still a lot more that needs to be done. So if you're hung up, you're not sure what to do, you have questions, feel free to call me. If I can't answer, I can refer you on. There's a really good network of people to work with. All right. All right, so the neck swelling, we talked about the venous engorgement, that backflow of blood. So soft tissues like your tongue, a lot of swelling. You have swelling of your eyelids, any kind of swelling of the head and neck. Soft tissue injury, we've talked about that. Internal hemorrhage. Some of the real more serious hemorrhages that they're seeing now is like your lymph nodes. You have these lymph nodes all the way down your neck, and they're very soft tissue, and they can be damaged and bleed inside too. laryngeal fracture of the airway, those little fractures that can happen. And then subcutaneous emphysema, that's the Rice Krispies in the skin. Always feel their neck. If you feel Rice Krispies, that means they crack their larynx. And they've got air leaking out. What happens when you have air leaking out of your lungs and you have a pneumothorax? It's life-threatening, all right? So air leaking out into the skin is very serious. She's got a crack in her trachea, and that's a medical emergency. Hemoptysis, coughing up blood. You saw how beet red that voice box was. See how beet red that is. And if they're coughing, and they also might have blood coming up from their lungs too, and muscle spasms of the neck. All right, so hyoid bone fracture, like we talked about that, it'll close off the airway in a matter of minutes or hours if it is fractured, because you lose your airway. If it's an isolated fracture, only in a strangulation. But what about those ligaments that hold it in? It's suspended in midair. It's not connected to another bone. Those ligaments can be damaged to various extents. You know how you sprain your ankle? It gets swollen 4 or 5 days later. It's okay, no big deal. Or you sprain your ankle and it's such a severe sprain, it takes weeks for it to heal, okay? That's a variance of the ligaments that support your ankle. Ligaments hold bone to bone. Okay, so those ligaments get sprained maybe a little bit, maybe really a lot, and anywhere in between. So you can also have sprained ligaments of your hyoid bone. All right, and that definitely causes problems swallowing. Petechiae. We talked about petechiae. Now you guys can explain petechiae, can't you? Do you get it? You want me to go through it again? The petechiae? Everybody gets petechiae. Were you here for that? Okay, petechiae is when you have the major vein that comes down, your jugular vein, draining blood from your head, right? The carotid artery sends blood to your brain, to your head, and then all the blood returns to your heart with through the jugular veins. If those are closed off, you have a damming effect, okay? Like the Hoover Dam, holding back all that water, okay? And that damming stops that blood from returning, so you get a back pressure, builds and builds and builds into those blood vessels all the way back to the tiny little capillaries that are a cell thick, okay? Teeny tiny little fragile capillaries where the actual oxygen exchange happens to cells. Those tiny little capillaries build up pressure more and more and more. Same thing that happens with a balloon that you've blown up and you keep putting more and more air in it past capacity. It pops, bursts. Those little blood vessels burst and the blood comes out, hemorrhaged, okay? The blood vessels rupture and leak blood. Those are tiny little red spots called petechiae. So if you see petechiae on the skin, you know this was a serious strangulation. Okay? Petechiae, due to venous congestion. And that is a real indication of the seriousness of the strangulation. All right? Subconjunctival hemorrhage, that is the bleeding of blood vessels in your eye. The covering of your eye is a jelly kind of covering, conjunctiva. Is that clear covering over your eye like a mucus thing. But there's also tiny little blood vessels in there. When you look real close in the mirror, you can see them. You know, that's what you use Visine to get the red out. Those blood vessels get engorged and red, or you get red eyes, okay? If one of those little blood vessels rupture and bleed out, you get a blood red eye. Same principle. Subconjunctival hemorrhage. That's from the eye, in the eye. So carotid dissections can occur. Get this. We have 3 up to 5 case studies now. Total 6 that I have found so far. Case studies written up in the medical and forensic journals of carotid artery dissections and occlusions that can occur days, weeks, one of the cases a year later. Okay? Now, a carotid artery dissection, is that very serious?
What's that?
What is that? What are our saying nurses? Tell them what that is.
Your carotid artery is the large artery that carries blood to your brain. It's very large. If it's dissected, it's broken, cut into.
Well, yeah. Or what happens with the carotid artery dissection and choking is you have 3 layers of an artery. There's the inner layer, middle layer, outer area to give it that strength. These 3 different layers of the wall of the artery, okay? When you have trauma to the artery that rips part of that inner layer, you get blood that goes in between the layers, okay? And that force of blood wearing and tearing on that dissects away that inner wall or the middle wall of the artery. And that's what supports that artery. And the artery can rupture as it's weaker. But also inside that tearing of that inside lumen of the artery occludes that part of the artery, okay? It blocks off that part of the artery. And so that there's turbulent blood flow. It's not straight, smooth blood. Blood is doing this kind of thing, like a washing machine in there. And you can get blood clots as a result. And those blood clots can go right up to the brain as a result of a damaged carotid artery. So what they have found is these women are coming in under the age of 50 with stroke symptoms, but they're young. And when they realize they have a carotid dissection or blood clot from a damaged carotid artery. So they go to her and say, what is this? Do you have family history of heart disease? Have you ever had a stroke? Have you ever had a heart attack? Do you smoke? Are you on birth control? They go through all the risk factors and find they have none. So why did this happen at a young age? And then somebody says, has anyone ever choked you? Oh, yeah. So they're finding that these women are having TIAs, which are mini strokes and carotid artery dissections that can only be related to a neck injury, a strangulation injury. Isn't that frightening? And this is months up to a year later. So my research that I would like to do someday, somebody wants to give me money to do my PhD, I'll do this research. This is what needs to be done. Either carotid Dopplers or an MRA of the neck to look at the carotid arteries. What do they look like on a woman that's never been strangled, a woman that's been strangled once, or a woman that's been strangled multiple times? I think it'll be very revealing. And further proof of the damage. Okay, so that talks about, it's a very interesting study. The one article covers 3 case studies. So what does that mean for you practically? In the ER, a woman comes in under the age of 50 with some strokes, some neurological symptoms. What do you got to ask her? Anybody ever strangled you? Good question. Also, delayed Parkinsonism has been documented after a strangulation injury because of the damage to the brain, that part of the brain. Isn't that interesting? We're just learning these things. So what happens is you have damage to the blood vessels in the neck, inside damage, like what I was describing, that inner part of the wall, inner wall, called the intimal wall of the artery. And there's damage. Anytime you have damage to an artery, you can get little blood clots that form. And then those blood clots go into the brain, and that's called a stroke. That's how you have strokes. Okay, so you have a dissection or a tear. Think of a dissection as a tear in the inner layer of that artery. And then you can get, either that can rupture, or you get a big blood clot or outpooching of that artery. Either way, decreased oxygen to the brain is the outcome, and that's a problem. Injuries to the airway, the Rice Krispies, subcutaneous emphysema, oxygen in the tissue, the Rice Krispies. And then life-threatening complications, hours, days, or weeks later. as in the matter of the carotid artery dissection a year later. Do you see why people can die up to 36 hours or later? You got to say or later, because these are all life-threatening. And how many women have died from strokes without realizing there was any connection to a previous strangulation? Interesting, isn't it? Give us 10 years. We're going to find a lot more strangulation victims with a lot more issues as more of them come forward. And if we take these victims seriously and we hold people accountable, more women that have been choked will find justice and realize I can come forward and get safe, and I can be safe, myself and my babies, because they will hold him accountable. All right, so neuropsychiatric effects. Early. Remember that lack of oxygen to the brain can cause many things, from a little bit of confusion to, what just happened to me, all the way to death, and anywhere in between. So here is the anywhere in between. Restlessness, combativeness, panic attacks. So the cops show up and she's freaking out. Well, that could be because she almost died. She knows that. It could be that, oh my God, I almost died and he's going to kill me. Or it could be that she's got some lack of oxygen to her brain. All right? She might not just be hysterical. Well, she has a reason to be hysterical, but it might also be because her brain doesn't have oxygen, and that is a brain damage, okay? Panic attack, flat. You may also be very flat and have no emotion. That's perfectly normal after strangulation, because who knows what part of your brain lacked oxygen. Vision changes, headache, eyelid droop, weakness, paralysis, unable to move your arm, unable to move your leg, tinnitus, ringing in the ears, sensory deficits, hypersensitivity or numbness, tingling of the face, of the arms, of the legs, seizures. When your brain doesn't get oxygen, you have a seizure, right? Loss of consciousness, incontinence. If someone has been incontinent of blood, of urine or stool, you know that they were very close to death.
The tinnitus, now, is that comes from the lack of oxygen to the brain? And I heard, and a survivor told me that it's been about a year ago during an interview, but it didn't connect with anything because I hadn't heard that before.
That's right. It can be because that. Also, the nerves of the neck that go to your ears and make your inner ear function. The nerves, or that part of your brain that allows you to hear, and that inner ear function can be off. Depends on what part of the brain. Anywhere in the nervous system in the head can cause tinnitus, the roaring of the ears, the ringing in the ears, room spinning, any of that. Any of those. Anything can happen as a direct result of strangulation. From nerve function, lack of oxygen to the brain dysfunction. So, also long-term, these women that have had repeated strangulations show a higher incidence of psychosis, amnesia, don't recall the incident, okay? Or only recall bits and pieces, because you know what? Your brain wasn't working then. Doesn't that make sense? So when these victims come up later on, they say, can't remember the story, or it's in bits and pieces. And the law enforcement and prosecutors are getting really frustrated. Well, she said this one time and then she changed the story. Do you know what that's called with strangulation? That's called evidence. It's called evidence. You know what? When your brain doesn't function, you don't remember right, okay? And so someone needs to speak up and say, no, that is consistent with a strangulation injury. And she may not ever recall everything because her brain wasn't working. You got to have brain function to have memory, okay? So also, dementia, early dementia. These women are getting progressive dementia at a young age. Anoxic encephalopathy may lead to brain death. Remember I said brain cells. Some die right away, some die later on. As those brain cells die, enough of them die, you're brain dead. Anoxic means lack of oxygen. Encephalopathy means something going on with the brain. lack of oxygen to the brain. That goes on long enough of those brain cells die, and you know what? The brain can't function. You're brain dead. And that may be progressive to brain death, especially overnight when that airway starts to close off and even less oxygen to the brain, correct? So, how do you know if there was loss of memory? Well, look up. The patient says that I was standing up 1 minute, woke up on the floor. Okay? Okay, she describes an episode of loss of consciousness, even though she doesn't know that. Unexplained bump on the head. She fell, hit her head, doesn't remember. Bowel or bladder incontinence is very serious, and victims will not tell you that unless you ask in an appropriate way. Law enforcement, you might not be able to ask that in a way that you feel is appropriate, so get one of your female cops or get a nurse to ask that question. But you've got to know that this is important, and you've got to know to have somebody ask it. Whoever is most appropriate needs to ask, did you pee or poop yourself? Let's find out. That is huge evidence. They almost died if they were incontinent of urine or stool. Unexplained bump on the head. All right, so vomiting. Here's another one. When you're struggling to breathe and you're in this vicious struggle, and your airway's closing off, opening, closing, opening, okay? He's pushing, and you're struggling trying to breathe. You're gasping for air, correct? When you gasp for air, you're swallowing air too, okay? And your stomach distends, it gets bigger, it's full of air as you're struggling to survive. Your stomach gets so full of air, it can, and you're in different positions, and you're screaming, you're doing whatever you can do, trying to not die, all right? And your stomach gets full of air, and it doesn't take much for that stomach contents to go up into your throat, right? What happens if you gasp at that moment as your stomach contents are coming up? Where does that go? Right into your lungs. And you aspirate. What happens when stomach contents go into lung tissue? Stomach contents, if you ever have in grade school where you take a piece of hamburger or a piece of meat in a cup, and you put some Coke in there, and you come back in the morning, what happens to that piece of meat? It's dissolved, okay? That's what happens to food. That's how our food's digested. The acid in our stomach breaks down food. It's very acidic. Acid in your stomach gets in your lungs. What do you think it does to your lung tissue? It destroys it. Acid in your lungs destroys your lung tissue. Of course, when you have stomach contents in your lungs, it's a little bit harder to breathe, isn't it? Okay? So again, you have lack of oxygen to the brain, right? Because you're not breathing right. And on top of that, the acid in your stomach is eating away at lung tissue, further decreasing the ability of your brain to function, because the lungs give your brain oxygen, right? There's another kind of injury you can stack up on all the other stuff that we just talked about. And when you have aspiration, it's called aspiration pneumonia, and what happens when that acid gets in your lungs, your body sends this tremendous amount of response to that, and your lungs fill up with fluid just trying to fight that, because you're trying to preserve lung tissue. Your body has defense mechanisms, and you got all this fluid in your lungs just trying to fight that. It's a severe form of pneumonia, and many people do not survive. They wind up on breathing machines as a result. Okay, so here's another one. This is another life-threatening injury that can happen in various degrees. When you have your airway occluded, okay? You put your finger on the base of your neck, on your airway, and you push harder. You can't push very far, okay? You know how people can't have things tight around their neck because they can't breathe, right? Our airways are, it's a very mammalian instinct to protect our airway, all right? You can't push very hard on your airway before, you just can't do it. It's too painful, it's too scary, your brain is screaming, stop that, all right? When someone has their hands on your neck and they're actually compressing that airway, it is a very frightening thing. And what happens is, if you're trying to breathe against a closed airway, what are you doing? You're going, and nothing's happening, right? What do you think is happening to your lungs when you're going? You're pulling so hard against a closed airway. Now, our lungs function because of a very minute balance of breathing in actively. We think about, I'm going to breathe, but when you breathe out, it's passive, okay? And the very central core of our brain tells us take a breath, don't take a breath. And we do it without thinking. Our brain does it for us. So, when you're breathing against a closed epiglottis, you're increasing that pressure in your lungs that you should only have about 4 or 5 millimeters of negative pressure in your lungs that allows breathing to be pretty passive, and you don't even think about it. It's because the cavity in your chest has a negative pressure so that it is such a passive passive breathing. About negative 4 or 5 millimeters of mercury pressure. So when you are breathing against a closed epiglottis, that negative pressure greatly increases to about minus 100, okay? A whole lot more. And what happens is, when you get that huge negative pressure inside your lungs, it's sucking in, that negative pressure is pulling in fluid from your blood vessels that bathe the lung tissue. It's pulling in all that fluid from your blood vessels. You know what pulmonary edema is? You get water on the lung? That's exactly what happens. You get this flash of water on the lung. What do you think that does to your oxygen exchange? On top of having stomach acid in your lungs, eating away at that tissue, on top of that airway being closed off, you get the picture? Have we said anything positive about strangulation injuries? Aspiration pneumonitis, pneumonia, and acute respiratory distress syndrome can happen, which is a gradual thing that happens over hours to a day or two after these injuries. And people are put on breathing machines to get over this because of all that fluid in the lungs. And the severe stress on the body trying to compensate puts them into acute respiratory distress syndrome. Many do not survive. Of course, miscarriage can occur. That's a no-brainer, isn't it? Lack of oxygen can cause miscarriage that might occur later. It might occur later, weeks later, as a result of this injury. Keep that in mind. So here's some photos I'm going to show you. And on the lighter side, this is I go to Peru every year and help them deal with child sexual abuse. And this is one of the markets. It's really quite unsanitary. You don't see the flies all around there, and you don't see the dogs walking back. And it's really gross, isn't it? But I'm not going to show you anything that gross, okay? But I'm going to show you some pictures. So those of you that don't like to see pictures, they're not really gross. But just know that you might want to do this kind of thing and ask the person next to you, should I look or not? And of course, if you feel like you don't want to listen to any more, this is overbearing for you, feel free to get up and walk away. I won't say anything to you, okay? Except, are you okay? All right? All right, so this is another picture I can show in court that shows what kind of things you might see with strangulation injuries. Blood red eyes, neck swelling, bruises, cord or ligature, scratches, spots. What are the spots called? Petechiae. Okay, so here's the injuries. The redness, right, from blunt trauma, marks on the neck. Bruises can happen from blunt trauma. Abrasions, rope burns. So here is And can you guys see that okay? Do you want me to turn the lights down a little bit? I'm going to show a bunch of pictures. It's okay? So, do you see this maybe thumbprint? Your thumb has more pressure than any of the other fingers and may be the only one that leaves a mark, okay? So one thumbprint's all you need. What's that called? Evidence, all right? Right there. And that's a bony prominence, okay? So the pressure against that bone causes that. What is this here? Petechiae, right? Do you see that? Now there won't be any petechiae down here on his chest, only above the level of constriction. All right? Look at that petechiae all around there. Bruises behind the ear. I never thought to look behind the ear of a domestic violence victim. And now I do all the time. And you know, I see bruises like I never saw before. I just never noticed them. Your index of suspicion is going to be screaming at you now, okay? Something somebody's going to say, and you're going to have that index of suspicion, and you're going to ask those questions and look. All right. So why do you get bruising behind the ear? You saw that thumbprint down here on this chin? If you got your hand and you want to squeeze, you got to have something to compress, right? So here and here, or here and here with a hand, you have a bone back here. So that gives you the ability to squeeze against something. All right? So watch behind the ear. One thumbprint may be all you're going to get, if you're lucky. Remember, no obvious injury does not mean it didn't happen, correct? Most often, you will not see that. So if you see something like this, oh my gosh, it's so exciting. It is. You've got good evidence. All right, so do you see this here? Those 3 marks from fingers or whatever, most likely from fingers. You can't say what caused that. You weren't there. You didn't see it happen. However, that's very consistent with a strangulation injury, isn't it? You got marks. You got probably multiple different types of holds. Yeah, and it says you're strangled repeatedly with 2 hands. So was it 2 hands? Was it 1 hand? Was it behind, a chokehold? Was it a knee on the throat? All kinds of creative ways to strangle people. All right, now what are these here? Do you see this? Curvilinear. See it? Half moon. What's that from? Fingernails. You bet. Okay, those can be from fingernails. Whose? His or hers? Either. That's right. She's going like this. Or he's going like that. It could be either, right? And he says, she's crazy. Look at what she did to herself, you know. Okay. That's what they'll say. They'll claim self-defense. He might have these marks on his neck. Okay? And the most important thing for law enforcement is to find the primary aggressor. Got to read between the lines. Got to look on her neck back here. You might not see that from the front. Darker skin, maybe not as easy to see. You have to look more carefully, but you can see it. Now, do you see these creases in her neck? How do you know that this here is not a crease in her neck? How would you know that? Mm-hmm. How else?
Been aggressive before, what her neck looks like when she has an injury.
Yeah. Get a follow-up picture a week later. Is it still there? Huh. Maybe that was a contusion. It's resolved. Okay? Don't hesitate to get follow-up pictures. And then that helps you. Also, there's more and more research that shows the alternate light. Alternate light sources, some of the certain ones, there's more and more research showing that can show early bruising or bruising underneath the skin that's not come out. Remember, bruising doesn't sometimes happen for a day or two, especially with deep muscles. You don't see the bruising for a day or two when that blood makes its way to the surface of the skin, and now you can see it. Alternate light sources can show that earlier. So there's another tool. So you just look more closely. Pay attention with the darker skin. Claw marks. That is probably her claw marks. She probably did that to herself. As someone has their hands on your neck, it's severely painful, okay? Severely painful. And then in a flash, you realize, oh my gosh, I can't believe this is happening. And then, oh my gosh, he's going to kill me. And as a result, we all have this inner fortitude that comes out, this mammalian instinct, okay, to survive. And your body sends that fear, fight or flight on steroids. Fight or flight on steroids, all right? You're about to take your last breath, and what am I going to do about my babies? I have got to survive. And you get that huge rush of adrenaline. It's what allows a man to pick a car up off a child. We've all heard those stories. That is that huge amount of adrenaline that goes to every muscle of your body and allows you to do amazing things. And it also allows a woman to take heart and do everything possible, even if it means gouging her own neck, to get that off her neck. Those are claw marks, and they're most likely hers. Okay? That's called a defensive injury. And when the perpetrator is telling law enforcement, look what she's crazy, look what she's doing, she's crazy, she needs help. No, look deeper. Primary aggressor. This was a particularly bad struggle, don't you think? All those claw marks with her trying to free her neck from the constricture and survive. So it might be difficult to find that primary aggressor, but remember, there is a primal instinct we all have to defend oneself. Even if it means scratching his eyes out. Wouldn't you reach for anything you can? You'd reach for his groin, you'd reach for his eyes, you'd reach for anything. And he might look worse than her. Right? You bet, especially if she's got those long fingernails. He might look worse. You got to read between the lines, don't you? Okay, so here is petechiae in the eyes. Little blood vessels ruptured. Look at here, though. Oh my gosh, that's what we call florid petechiae. Look at that red. I mean, her face is red, right? That is florid petechiae. All you need is one little red dot, right? And that's called what? Evidence. And Lillian and Mark will thank you. All you need is one, but look at all of these. Look at that. So how do you know if this isn't just normal markings of her face? How can you tell? You didn't know what she looked like before this. What if somebody says, oh, those are just marks, those are just the marks she has on her face, don't worry about it. Well, how do you know? Take a follow-up picture. All right, a week later, let's get another picture of that face. All right, it's there or not. It'll resolve after a few days to a week. All right. So that's petechiae. There's petechiae. You have to lift those lids up. Lift the upper lids up. Look down. Look around. Open up these lower lids. Look carefully. Look at this little boy. What do you think that's from? Look at all that petechiae. In his nose, he was smothered. Okay? He was smothered. See how there's nothing down here? It's all up here. See those marks? You might only find it in the scalp. Remember, anywhere from here up, you're going to see it on exposed tissue. Look in the scalp. Part the hair and look at the scalp. All right? All you're looking for is one petechiae. One. If you find a bunch, that's wonderful. But you're looking for evidence of this strangulation. You do not need to have petechiae to prove strangulation. All right? You do not. But if you can show petechiae, now you can get on the stand and explain just how that petechiae happened. It's pretty scary, isn't it? Look in the ear. Tara Henry, you guys know Tara Henry from Alaska. She used a colposcope and got pictures of petechiae in the ear here. So she blew it up with her colposcope. Creative, isn't it? Yeah. So Dean Hawley, that forensic pathologist in Indiana, he started this whole movement with Gail Streck many years ago in 1995, 98. And he has doing his own research and has been, he's testified thousands of times in these cases. He says, I heard him say this one time at a conference, if there's petechiae on the skin, there's petechiae in the brain. Whoa, that's good, isn't it? I like that. So, you know, I need to have evidence. I can't just say that. So afterwards I went up to, and he showed this picture of this brain, okay? This white matter of the brain that's been dissected, and there's all these little red polka dots everywhere, just diffused throughout this tissue. And he said, if there's petechiae on the skin, this is what you're seeing in the brain. I'm going, ooh, that is so good. So afterwards I said, Dean, I like that. I've never heard that before. That's very interesting. So where's the research to back you up? I want to be able to say that. So where's the research that gives me the ability to say this? And he says there's no research. There's no research on this. But I'll tell you what, any forensic pathologist you talk to would agree. So I said, so I can just say, you said that? He said, you bet. So Dean Hawley says, if there is petechiae on the skin, there is petechiae in the brain. All right? So how do you prove that? You got to take live people and cut their brains out and see if there's any petechiae. We don't do that. So, but forensic pathologists that see this routinely will tell you that. If they got petechiae in the skin, you're going to see polka dots all over in their brain. So what does that do with living non-fatal strangulation victims? What's happening to their brain? Interesting, isn't it? And what's the cause? What does that do when you have petechiae, little ruptured blood vessels all around in your brain tissue? What do you think that does? Not good. It's not healthy. I'm sure it doesn't improve brain function. Further research will back that up, hopefully. All right, so subconjunctival hemorrhage at blood red eye is from constant compression release, constant compression release. This is the blood red eye. Look at this woman's face. Florid petechiae. Can you imagine how that's changed the whole coloring of her skin and her face? Some victims will say, as Teresa said, I couldn't wear my clothes. None of my clothes worked. They didn't look right on me. And I couldn't figure out. I said, Teresa, I saw her picture. She looked like this. She didn't have the blood red eyes, but she had this florid petechiae. I said, your face was orange when your coloring is different. None of her clothes looked right on her for months. That's why. So the victim might tell you that. They might not say, I have these red spots all over my face. They might say, you know, my skin was different, my clothes didn't look right. That's a clue, isn't it? All right. Blood red eyes, look at that. It's painless when you have a blood red eye. You get poked in the head, you get poked in the eye, and you get this blood red eye. It's like a bruise in your eye. This doesn't hurt. It looks awful, and it resolves gradually. Massive tongue swelling. Boy, that'll close off your airway in a hurry, won't it? On top of everything else. All right, let's see. Rope burns, hanging versus ligature strangulation. So this is just for your information. People will say, well, you know, somebody that was maybe survived partial hanging, and they come into your ER. Hanging is usually right up the ear here, where a strangulation injury is across. That is because when you're hanging, remember we talked about that definition of a hanging injury, or hanging episode, where your body finally lets loose and you go down, and so that rope goes up. Your head goes forward and the ligature goes up behind your ear when your body weight just gives out. So typically, not 100%, but typically, it's up behind the ear, where strangulation, ligature injuries are usually across from behind. All right, so here's a picture of a hanging injury. And do you see this coming up behind the ear rather than this way? Okay. Autoerotic asphyxia, there's a lot of different names for it, and sometimes you're not, the escape hatch doesn't work, and they do die. Okay? So it might not have been a purposeful suicide. It might have been just, oops, I didn't do it right this time, and I died. Okay? Who was a famous actor that was found hung in his closet? And that was one of the things I always questioned was he doing autoerotica? And it didn't turn out so well. And before somebody says, well, that was from, it was a sexual thing that they did all the time. Well, if so, then there's probably more things around the room, like with bondage or those kind of things, that would be more consistent with it. But it does happen. And the choking game, please, if you have children, talk to them about this. This is a game that has been going on for many generations, maybe the beginning of time. 12, 13, 14-year-olds, you know, they got no brain cells during those years, right? They do stupid things. And they pass this along to all future generations, like, watch this. This is really cool. So somebody goes and gets them in a chokehold willingly. Here, I'll watch this. Chokehold, and just before they lose consciousness, they let go. They get this huge head rush. It's just it's a high. It's so cool. And they don't have to drink alcohol. They don't have to smoke any pot or do drugs. They can just do it on their own. It gives you a rush. It's really cool. All right? Some kids wind up doing this a lot. And you'll see kids that will maybe a tie around a bedpost or a doorknob. They can stick their head in, okay, and then they come off. What if they don't escape in time? You think it's a suicide? It might not have been. It might have been a choking game that he wasn't able to get out of. All right? When your child comes out of the bedroom disoriented, confused, this happens a few times, you worry about the choking game. Go to the CDC website and look up choking game. There's a lot of good information on that. So that's another form. Please talk to your children about that. CDC studied youth 6 to 19 years of age. Maybe misinterpreted as suicide, and it was only the choking game gone bad. Talk to your children, okay? So just when you think you want to, here's all these warning signs that they talk about. Pay attention to that. There's a whole lot of information online about that. So just when you think you want to choke your teenagers and you think, oh my gosh, I'm not going to survive these teenage years. These are my kids and my wonderful hubby years ago when they were all adolescents. And you feel like you just want to reach that phone and choke them, right? You just love them through it. And they turn out okay. Here's my babies. All right, so real quickly, what's evidence? Wet to dry neck swabs. You say, nurses, pick up. If there's enough pressure on the neck to leave a mark, there is also enough skin cells donated to that neck that you can wipe off and get his DNA. More and more. DNA has become a lot more sophisticated. We're lifting up wet to dry swabs off of pressure erythema of the neck, okay? You know, we do wet to dry swabs all the time on breasts of victims of strangulation. They don't even know if his mouth touched your breast, but you do it anyway. You're finding good wet to dry swabs even days after, showered and all. You're getting wet to dry DNA off of their skin. So wet to dry swabs of the neck might be helpful later on in that investigation. Documented. Narrative history is the most important documentation evidence that you can get. Checklists are helpful. In that packet, the handouts that you can get from Lillian is also a documentation form that I did that I wanted it a one-page so that all ER nurses could easily do it. It wouldn't be intimidating, and more documentation would be done. So it's just a one-page, and that's, I think, really helpful. It's not as intimidating, so that all nurses can do this and remind them to look here and look there and document certain things. Wig head. You know what a wig head is? Wig head is wonderful. When you ask this victim, I would ask the victim, show me what he did. They know what he did, right? Show me, don't touch my neck, but I want you to show me with your hands, how did he choke you? Show me what he did. And let her show you. This is what he did, and then he did this, and then he did this, and then his knee on my neck, okay? And get a picture of that, all right? Get a picture of it. Now, another way to do it, get these wig heads. They're $1 or $2 a piece at a cosmetology store. These little foam wig heads, right? All right, find a pink one or something, you know. You can keep them in your car. You can keep them in your sane room, in the ER. So you give her the wig head. Tell me what happened. Get a picture of her showing you what he did. Isn't that great? And then you can show the pictures of your injuries and how consistent that is with what she said happened. This is what she said he did. And sure enough, there's marks on her neck for the thumb and the fingers or whatever. Okay? It's called evidence. It's really good. And wig heads are really easy. They're cheap. First time I testified, the prosecutor comes up to me on the stand and says, is this is kind of what happened? And he put his hands, right close to my neck. I'm thinking, that was just too weird. I didn't like that. I said, Dave Yost, I didn't really, we got to do something. So I asked him to get me one of these torsos that I used in court then. So he didn't have to come up and stick his hands on my neck. I was like, let's do something different there. But wig head, that's cheap. The torso costs $900, A wig head's great. Use body maps. You all know how to use body maps. Wonderful. When you show a jury, talk about these injuries, you show them pictures of what happened, you show a body map of where her injuries were, they get it. Juries totally get it. So your patient history is subjective, but it may be the only indication of how lethal this is. All right? What she says, if she was really scared, you better believe it. All right? Use quotes, of course, open-ended questions. Describe the method on that wig head from the front, from behind, one hand, two hands, carotid restraint like this, or ligature, and what was used. All right? All those things are very good for the ensuing investigation to have. What did you feel? These are the questions you want to ask. Now, I'm going to advocates are great. You guys need to ask these questions, okay? Healthcare and law enforcement also needs to ask these questions. Advocates, you can have, if they don't want to go to law enforcement, they don't want to report it, just ask them, here, keep a diary. I want to hear every day. I want you to write down all the things that are happening to you. What kind of issues you're having, concerns you're having, write them down. If she decides to report later on, that is really good evidence of the injuries that she's suffering from. Okay? All right, so how do you feel? We're going to ask that in healthcare because so many times we're restricted. We feel like we should not ask certain questions because it's investigative, right? And as forensic nurses, we are neutral. So we don't want to cross into investigation. That is for law enforcement, correct? Do not be intimidated to ask these questions because our state mandates, Joint Commission, what do they say is our most important task in healthcare? Our health and safety of our patients, correct? All right. So you can ask every single one of these questions and do not be intimidated because you want to know how safe is it for her to go home from this ER tonight? And how much do I need to say, you need to be in a shelter and really encourage her to go to a shelter? You are doing a lethality assessment and a danger assessment. You are concerned about her health and safety. And don't let anybody tell you that what you're asking is investigative. That's for law enforcement. You say, no. I am concerned with the health and safety of my patients. And so I need to know what risk to threat of life she is to her and her children, and whether she can go home from the ER. Do not be intimidated to ask these questions, okay? Was that strong enough? But some people will intimidate you. Oh, that's investigative. She has to tell law enforcement that.
Yeah, but the older you get, the crazier you get, so it works well.
You're darn right. You're darn right. We stand up. We are advocates for our patients. So how did you feel? This is what people will say to you. I felt a rush to my head. I felt fuzzy. I couldn't breathe. I thought I was going to die. Do you think that's important to document? You bet. You bet, because you know that she thought she was going to die. And so you are very concerned to let her go home to that same environment if he has not been arrested and he's at home waiting for her. Are you going to send her back home? I did that one time. Dad was there. He was a daddy bear, man. And he was going to take her. The cops had gone out to get her partner. They're going out to arrest him and put him in jail, okay? Dad says, I'm going to take her to my house, and I'll be there with her. And I said, okay, that makes sense. Cops are putting him in jail. Dad's taking her home. He's going to be with her. I felt okay to let her go. Well, what happened was, before the cops could get to the house to get him, he took off. They didn't get him. She went to her dad's house. Dad goes to work the next day. Guess who shows up? She was gone for 3 months. No one knew where she was. I will never let that happen again. That was so scary. I will never let that happen again. I will call that law enforcement officer and say, I'm keeping her here till you got him. Are you keeping him overnight? Let me know, because I need to know whether to let her go home with Dad or not, right? Make sure, never assume. I will never let that happen again. That was so frightening. She came back after being in multi-states with him. He held her captive. She was able to get away, and she was okay. So what did he say? If I can't have you, no one can. Whoa, that sounds pretty lethal, doesn't it? Isn't that what they say just before they shoot them? He was laughing when it came to on the floor. He told me no one would believe me, since he knows how to do it without leaving any marks. So she never told anybody. And this had been going on and on and on. I saw the devil in his eyes. What did you see? It's an open-ended question, right? But what they describe very often is a highly lethal situation. This guy, who's normally very calm, everybody thinks he's the most wonderful man. He's such a good guy. He does so much for our community. He's a good dad. He's a youth pastor. My youth pastor's in prison right now. You know that? Raping a 14-year-old. I'd have never known. Okay? He's your youth pastor. He's such a good guy. What did you see when he was like this? He was crazy. He had the devil in his eyes. Quite different than what we would see, right? She saw something different than you, and you better believe it and document it. What were you thinking? Okay, so how close do you think, what did you, her assessment of the whole situation is very important, right? No marks on her neck. She said he choked me and this and that, but what were you thinking when this happened? I thought I was going to die. I knew he could kill me. So this was scary enough for her. You better take it serious too, because in healthcare, we are worried about the health and safety of our patients, correct? So you can ask those questions. And why did he stop? Someone knocked at the door. I passed out. My child started crying and he stopped. Oh, that's interesting. What if that child was not in the house and had not started crying? Would she be here today? Good question, right? It's a highly lethal situation. Medical evaluation. This is what we do. You're asking about what can we do in the hospital. These people need to be watched, observed overnight, in my opinion, and to keep them safe, to evaluate their dangerousness, their danger assessment, and to make sure that she's okay to go home into this environment again. That doesn't always happen. Actually, it rarely happens. But we need to encourage it. We need to do at least a pulse oximetry to show that oxygen level percentage is adequate, and repeat that. Do that 2 or 3 times to show that it's not deteriorating because of that swelling setting in, correct? Then chest x-ray might show some pulmonary edema. However, that pulmonary edema many times doesn't show on an x-ray for a day or two, even though it's occurring. Lungs do not consolidate with pneumonia to show on x-ray for a day or two. So just because it's a negative chest x-ray doesn't mean she doesn't have some aspiration. It may not show up. Understand that. Tests are only so good. Subcutaneous emphysema would show on a simple x-ray. Pneumonia and aspiration. So if they're not doing good a day or two later, get them in for an x-ray. That might show some things. Also, soft tissue of the neck, CAT scan. Minimal CAT scan of the neck. However, it doesn't show a lot of the soft tissue like an MRI will, and an MRA will show vascular damage. So all these things will show up on a medical evaluation of the soft tissue neck, okay? At least do that. At least do a soft tissue neck. If they're worse the next day or two, you can compare the two, okay? And evaluate for closed head injuries. Many times, a woman is strangled and choked, grab her neck, slam her to the floor, okay? Or grab her by the neck and slam her to the wall. There may also be accompanied closed head injuries. Always keep that in mind. This is an interesting study done in Switzerland. 14 patients surviving strangulation were evaluated. They were evaluated on a physical exam. They have forensic physicians there that deal with living forensics, okay? They're sane nurses, okay? Our forensic, same in Switzerland as a forensic physician. They evaluated these victims. They compared the exam with MRI findings. And they had 2 different radiologists doing MRIs of the neck of these victims. And none of them were talking to each other, okay? Independent collaboration. A forensic physician examining that survivor of strangulation, and then 1 and 2 different radiologists interpreting an MRI of the neck, all right? Then they put all the information together. What they found was the MRI may demonstrate life-threatening injuries that do not appear on the exam, all right? What might appear as no injuries or very minimal injuries on the skin show life-threatening injuries on the MRI. Specifically sensitive to that are petechiae and bruising of the neck and of the deeper structures, and voice changes. Those are the 3 that they thought, you know, when you see those signs, chances are good there's potentially very serious deep tissue injury, okay? So petechiae, sore throats, and bruising of the neck, very, very important. They probably have some deep, deep tissue injury that's life-threatening, considered life-threatening. But this is an initial research. We need to have follow-up. So for patients with no petechiae and less severe injuries of this group, 4 of them had hemorrhages in close proximity to these critical neck structures, deep neck structures, okay? They decided these areas of the neck are critical areas. So people that had, 4 of these patients had no petechiae, looked like minor injuries, very minor. But they had hemorrhages very close to these neck structures that they decided this was life-threatening injury, okay? Also, all patients with petechiae also showed hemorrhages in these critical areas. So if there's petechiae, you better take it really serious, all right? Head, neck, CT, or MRI, as it should be done. Carotid Doppler, if there's lateralizing symptoms such as facial droop of one side, okay? Numbness of one side of the face. You need to look at the carotid arteries because one of those might be dissecting. And a laryngoscopy, that's it, looking down, that scope, looking down to check out the airway. But remember, if you've only seen them within hours of this injury, it's going to be worse tomorrow. Count on it. If you're worried today, you better keep them overnight and really watch these people. So here's some documentation tools that Diana Fuagno, you know Diana Fuagno, came up with this for Gail years ago. And it's a 2-page documentation tool that you can use. And I can get that to you if you like. It's also on Gail's website. This is a tool I came up with, and Lillian can get you a copy of that. And it's a Word document, so you can put your own name on it and alter it however you want. It's just a tool you can use, change it to however you like. But what's really nice is it asks you all these check marks: any loss of consciousness, coughing, drooling, any of these things, to remind you at 3 o'clock in the morning when you're examining this person, oh yeah, I got to be sure to ask that, okay? Document on the maps, and then if this isn't enough room, get another page to document your history. Make it easy. So, discharge instructions, make sure that you have return for all of these things, just like a head injury. And those of you advocates talking to patients or victims afterwards, and you're concerned about these things, these are specific things for head injuries or for strangulation that you need to make sure they know. If these things happen, get to the ER right away. All right? And if you ask them to do a diary, many advocates are advising them, write a diary. I want you to see every day what's going on. What are things happening to you that are odd or just not right? They might be really helpful for you now because you understand the underlying trauma and injuries that are occurring as a result of this. And you can advise them, get to the ER if it gets worse. Daily log of symptoms, any skin changes, and checklist of what to report right away. Remember, seconds to unconsciousness, minutes to death. Victims can die up to 36 hours or later, correct? With no visible external injuries. Pretty scary. So here is a video I want to show you. Lillian saw this video and she asked me to make sure. So this is, it's a very short, but I want you to watch. This is someone being strangled. All right? So I want you to know that's what you're seeing, if you want to look at it. And how quickly this can happen and come to. Okay? Remember, it can go anywhere. It only takes a few seconds to unconsciousness. If its pressure is let up right away, you can regain consciousness, right? Doesn't mean nothing happened. There's still some trauma there, correct? At least to the brain, because your brain stopped working. What if that pressure continues longer? More brain cells die, more brain cells die, all the way to brain death, okay? And just before your brain dies totally, just before you die, the part of your brain that says, don't pee, don't pee, don't pee, don't poop, don't poop, don't poop, let's go. That's how you lose urine and stool. Your sphincter that keeps that in your body until you say, okay, I'm going to have a stool or I'm going to pee, doesn't work. The next step to your brain, that's the very core of your brain. The next one says, don't breathe. And you don't breathe, and you're brain dead, okay? So if someone loses urine or incontinence, it's way down the end. This is at the very beginning, okay? It's not going to work. Okay, so, shoot. Okay, do I need to wake this up? No?
I don't know. And I don't know if our filming man in the back.
No, yeah, previous, let's do previous. And I'm clicking on it. It worked earlier, so it's just got to wake up maybe, and then, okay, here it goes. Watch. It's 8 seconds. And she's standing up. Because it was a very short time. Okay? It only took 8 seconds. It's another video that there's been on that shows about 5 seconds to unconsciousness. You see how quickly that can happen? And she came right to. That doesn't always happen, but that can happen too. She was totally out of it. But he released the pressure, and she was able to regain consciousness. One neurologist at one time in one of the articles says that without any research, of course, to back her up, she truly believes that there may be a point of no return. You know, we all know 4 minutes to death, 4 minutes lack of oxygen to your brain, you're brain dead, right? But there may be a point of no return, and she estimates about 50 seconds, where when that, if there is lack of oxygen to your brain for 50 seconds, when you release, even though blood resumes flow to your head, your brain may not be able to revive, and you could be brain dead. She estimates it's probably a point of no return about 50 seconds. Of course, how do you prove that? But that's her estimate. So again, way back to the beginning, we talked about San Diego City Attorney's Office research, okay? 300 cases, right? And attempted strangulation, you hear this a lot. I never liked that term, attempted strangulation. It's almost like, you know, he went like this. I'm not really going to do it. And then, you know, that's attempted, right? No, he did it. His hands are on her neck. It's strangulation. Don't use the term attempted strangulation. Call it what it is. It's strangulation. All right? He didn't attempt to do it. He did it. So it's strangulation. What we refer to it as non-fatal strangulation, just because most people say he strangled, well, she must be dead. No, you can be strangled and survive, and that's what we're talking about with victims. Non-fatal strangulation. So there you go. 16% had visible injury that could be photographed and evidence, correct? Only 16%. Do we know more now as far as getting evidence and proving that it's strangulation and the seriousness of it? You bet. You bet. And we need to take this information and share it with everybody around us. Family, friends, coworkers. All professions need to know this because we are all see victims on the front line and we need to intervene. So the medical forensic assessment and documentation is a missing piece in providing safety for our patients. Law enforcement, Mark does this all the time. He sees domestic violence victims every day. So does Lillian. All our prosecutors do, right? That's what they do all day. In healthcare, well, advocates, you see them a lot too. Healthcare, we see them. Many times we don't pay attention. Of course, sane nurses do. But the rest of our healthcare partners, they see them all the time. They turn their head, they walk away. We need to get them on board. We need to share with them how serious this is, and they need to be on board with us so that if a victim decides, you know what, I'm going to report it, I'm scared to death, I want safety for me and my kids, you collect the evidence. Healthcare will then collect the evidence. So law enforcement and the prosecutors have evidence that they need. They need that from healthcare. We are the missing piece, and we need to be more on board. Just when in law enforcement, Mark, you guys think you got it low funds, right? This is our law enforcement, National Police in Huánuco, Peru. This is the police station. Isn't that cool? It's very cool. And they're very proud of their open-air police station. So, felony versus misdemeanor. What do you want to do? How do you call this, a felony or misdemeanor? In most states, in my state, it's many times considered a misdemeanor. He choked her, he threw her head up against the wall and called her names, and he might get an overnight in jail at the most. But if you have a good prosecutor, like our prosecutor, Marianne Hemmeter, who is now with the AG's office, she'll bring it on, man. She'll take these cases right on. And she'll try these cases as felonious assault minimally, even up to attempted murder and kidnapping. And she'll get felonies off of these. Not everybody does, and we're working right now to get felony strangulation in Ohio. We don't have a felony strangulation law. 29, 30 other states do, and you do also. 2008, you got a felony strangulation law, so it's automatic felony. So what happens when a strangulation patient shows up in the ER? Do you report it or not?
There's a weapon or anything involved, yes, but if she just came and said we'd strangle her, it'd be
Up to her? Is that, Lillian, do you agree with that? But it's a felony.
It's not the felony that dictates, it's the use of a weapon that's reported. And if there's a weapon, then it's mandated through the health laws and other regulatory agencies that say that they must report to law enforcement. Now, whether the victim's cooperative and speaks to law enforcement when they get to the hospital is a whole other issue. But the hospital would notify law enforcement if a weapon was reported having been used.
But isn't it also if there's a threat of serious bodily harm?
Not necessarily, no. Not my understanding of the medical mandate.
Wow.
No.
So that's why some states are actually saying in their statute that the hands are a weapon. They're specifying that hands are a weapon. Because in Ohio, we have to report, we're mandated reporters for felony offenses. So somebody comes...
Child abuse and, yes, I mean, there's certain...
Right. And for us, strangulation would be in that. If you recognize that as a threat of serious bodily harm, then we have to report. If you don't, and most people don't, and we leave it up to the victim to decide whether to report or not, but we have to at least call law enforcement if we suspect threat of serious bodily harm. So, you know, and it's left up to the healthcare provider for a reason. You need to be able to have that discretion, but when we have a felony law, we will be mandated to report felonies.
I think if I were in a situation and the patient was telling me that she was really afraid, et cetera,
Right.
then I would say to her, I would call law enforcement and get them involved.
Absolutely.
So that, because that would make keeping her safe. I mean, I would definitely
Right.
do something like that, but, yeah.
Yeah, so in Ohio, I mean, ours is threat of serious bodily harm, we have to report, we're mandated to report. So somebody should, you know, because it's a public safety issue, this person's going to, if it's that threat of serious bodily harm, he needs to be locked up or at least assess the situation because he's dangerous to the general public. So that's what a lot of states are going at right now, is strengthening their legislation so that strangulation is considered very seriously. So use your expertise in court. Any of you can be expert witnesses now after this. You've got the knowledge. You've got more information than the lay person on this injury. And you can discuss and explain to a jury why this is occurring. So take it seriously. There's a lot more information in the bibliography. There's an article that I wrote, and there's another article on the prosecutors' and law enforcement's perspective on prosecuting and investigating these cases. Look everything through. Get a good knowledge of it. So Minnesota got a strangulation law early on, and what they found within a year after having their law, this is what they found. There was increased awareness of the potential lethality of strangulation. It increased victim safety, and they think it should prevent homicides. Homicides are going down in their state. They're holding people accountable. And when you hold people accountable, those abusers know this, and they go, ooh, maybe I shouldn't do that. You're tipping that scale from nobody's going to care, I'm just joking, or no big deal, to, ooh, maybe I shouldn't do that. Okay? You're going to tip that scale, and you're going to hold, you don't have to hold everybody accountable, you've got to hold a significant amount so that victims then can come forward and say, I need to be safe, and this is what he's doing. So this is the FamilyJusticeCenter.org. Go there. They've got strangulation training on now. There's a lot of information they just put up because we just started the National Strangulation Training Institute. Big grant that they just received, and we started this institute. There's a lot of things on board. You can ask to go to their strangulation train the trainer, and how to, there's a 3-day train the trainer, and there's also a 2-day how to develop your experts in your community. And we just sent 5 people from Ohio, and they drank the Kool-Aid. I mean, they're just so powered up. We sent law enforcement, a healthcare person, a SANE nurse, an advocate, and prosecutor, did I say? And they're fired up. It's like, let's go. We got to get this out there. So get online there and get more information, and then use this. Share this with your colleagues. Share it with everybody around you. Get this knowledge out there. We've got to be able to address it. And let me know if you have any questions, concerns, or whatever. Are you overwhelmed? Okay.
Thank you.
You are welcome.
Could I note 5 minutes before I start, and I promise I'm going to keep my things pretty limited and get y'all out of here relatively soon, but we have been sitting for a while. Would you like a moment?
Yeah.